CARS is a community allied health service under the umbrella of Bendigo Health. The purpose of CARS is to assist people to continue to live safely in their home and prevent premature admission to residential care support. The services provided by CARS include dietetics, speech pathology, physiotherapy, occupational therapy, podiatry, and exercise physiology. It provides services for the 6 local government areas within the Loddon-Marley region. The dietitians at CARS provide predominantly home-based or clinic services, but also some group educations. Generally, the clients who are eligible for CARS services are frail adults over 65 years old, or over 50 years for Aboriginal or Torres Strait Islanders, or younger people with a disability and their carers. The service fundings can be seen in the list below, or you can pay by a fee for service. The current project aims to assist in providing recommendations on how to manage the dietetic referrals received for weight management at CARS. To understand the background of our project, it is important to know a little bit about the area CARS services. Loddon-Marley is a rural region with an ageing population, high incidence of disability in the community, and a large Aboriginal Torres Strait Islander population. This region has poor access to healthcare compared to metropolitan areas, and this is associated with poorer health outcomes, including high incidence of lifestyle-related diseases, and also the lowest male and second lowest female life expectancies in Victoria. Furthermore, a high percentage of the Loddon-Marley population experience food insecurity compared to the state average. Finally, Loddon-Marley also has the highest rate of obesity in Victoria, which is specifically related to our project at CARS. With consideration for the barriers of health experienced in the Loddon-Marley region, the goal of our program is to improve the nutritional status of people within the Loddon-Marley region to reduce the prevalence of lifestyle-related disease and improve quality of life. I've also listed out the objectives of our project. They focus on reducing the incidence of lifestyle-related disease in the Loddon-Marley region and also increasing the prevalence of healthy behaviours. The first strategy encompasses the project we are completing at CARS. It is to provide evidence-based recommendations for weight management to increase the effectiveness of dietetic intervention for managing lifestyle-related disease. Due to the time constraints of the project, we won't be implementing changes to the dietetic service at CARS. However, we will be conducting the evaluation and literature review of the current evidence to provide evidence-based recommendations. Hopefully, CARS can then implement these recommendations and evaluate if they are effective in the future. For the needs assessment, we will investigate the gold standard dietetic interventions for health and research the best evidence available for weight loss interventions. We will also investigate the key barriers to health in the Loddon-Marley region. This is important because an individual's health is largely impacted by the social environment. This is known as the social determinants of health, a framework that considers the social and environmental factors that influence health. In the Loddon-Marley region, it will be important to consider the rural setting because people living in rural settings are more likely to experience social and environmental factors that negatively impact their health. For example, high unemployment rates, financial insecurity, food insecurity, and poor access to healthcare service. The planning stage encompasses the goals, objectives, and strategies I spoke of in the previous slide. We attempted to create strategies that address the different social determinants of health relevant to the Loddon-Marley region. For example, the free recipe book with budget recipes aims to address the high financial insecurity in this region. Our project focuses on one strategy that aims to improve the effectiveness of dietetic intervention to reduce incidence of lifestyle-related disease in this region. The implementation stage is the evaluation of the current dietetic services at CARS. We will benchmark other community health services, interview the CARS dietitians, and look at the outcomes of previous and current clients. In the evaluation/results, we will be looking at the findings of the evaluation and comparing them to the literature review to make recommendations for future service. In the implementation and evaluation stages, we will need to explore the concept of client-centered care. Client-centered care is about ensuring the individual is provided high-quality healthcare with respect, compassion, and also made part of the decision-making process. The dietetic service has a high number of referrals for overweight and obese clients, and this is a group that experiences high level of discrimination in healthcare. Therefore, from our evaluation of the current dietetic service, We want to develop recommendations that aim to reduce the discrimination experienced by people in larger bodies to ensure they receive high quality healthcare in a respectful manner. This is the timeline for our project, which outlines where we would like to be with our project each week and the key assessments, meeting and extra activities that we have booked in over the 5-week period.